Good morning, student. I am T. Sasikala, Associate Professor of Economics, Sri Sada College for Women, Salem. Now I discuss about healthcare and poverty linkages. Healthcare is important factor in everyone individual in the world. Poverty and poor health are inevitably related to each other worldwide. It has been seen globally that reason of poor health for million individuals are rooted in political, social, economic injustice. Poverty is responsible for the causes as well as the consequence of poor health because poverty increases the chance of poor health. Poor health traps communities in poverty. Millions of poorest and vulnerable people die or become weak every year due to infectious diseases. Poverty leads to some health consequences. Population living under poverty is prone to immature death and various forms of disability. Under the situation is prone to immature death and exposed to great risk from unhealthy conditions at home and workplace. Poverty, inequality, and health are deeply intertwined, with poverty and inequality acting as a significant drives of poor health outcomes, impacting to assess healthcare, nutrition, and overall well-being. To explain poverty and healthcare linkages, first one is related to poverty and health. Access to healthcare. Poverty limits access to quality healthcare, including preventive care, timely diagnosis, and treatment. Nutrition is related to poverty often leads to inadequate diets, resulting in malnutrition, micronutrient deficiencies, and increased susceptibility to diseases. Living condition, poor living condition include inadequate housing, sanitation, water access, contribute to the spread of infectious diseases and other health problems. Stress and mental health. The constant struggle to survive can lead to chronic stress, anxiety, and depression, further impacting health. Next one, inequality and health. Unequal distribution of resources, such as inequality in income, wealth, opportunities, creates disparities in access to resources that are essential for good health, such as education, employment, and social support. Social determinants of health. Inequality can related to such as discrimination, stigma, lack of social discrimination, which negatively impact health outcome. Psychological effects. Living in a society with high level of inequality can lead to feeling social exclusion, hopelessness, reduced social trust, which can negatively impact of mental and physical health. Underinvestment in public goods. Inequality can lead to underinvestment in public goods such as education, healthcare, infrastructure, which are a crucial improving health outcome. The cycle of poverty and ill health. Poverty and poor health are often mutually reinforcing. Ill health can lead to job loss, reduced income, perpetuating poverty, while poverty can further compromise health. Health as a social issue. Addressing the health inequality requires a broader approach that tackle the underlying social and economic factor that contribute poverty and inequality. Poverty may be defined as a lack of basic necessities of human. Poverty is due to lack of resources, material and non-material like healthcare, education, housing, nutrition, clothing, clean water, knowledge, culture, income, etc. Poverty is the worst problem in India when the people are distressed due to basic everyday things that we daily take for permit or otherwise granted like money, clothes, food and shelter. Poverty is a major problem for socialists. Poverty was once examined as a social problem and sociologists carried out research to understand this problem and tried to provide the solution to solve the problem of poverty. Poverty related to three circle. The poverty leads to integrated solution over health. This three circle is interrelated to each other. Types of poverty. Poverty is mainly two types, absolute poverty and relative poverty. Absolute poverty may be defined as the situation where family income is inadequate to buy basic things of life. Example, shelter, clothing, food, healthcare, and education. People in absolute poverty inclined to fight to live and experience a lot of child deaths from preventable disease. Absolute poverty is a state of severe deprivation of basic human needs. Another one is relative poverty. According to relative poverty, the economic condition of different countries and regions is compared. Relative poverty is defined as economic imbalance in location or society in which people live. Relative poverty is usually in relation to other members and families in the society. Example of relative poverty, a family can be mentioned poor if family cannot afford vaccination or cannot buy any presents for children at Deepavali and Holi and any other festivals. Relative poverty is economic inequality in location in which people live. Causes of poverty. The causes of poverty related to the circle, the poverty occur, the people affected some of the factors like stress, lack of resources, time, money, poor expensive to select the food choices, food poverty, poor health, mental health expenses. These all related to the circle integrated to each other. The causes of poverty is the main reason for first thing unemployment. Second one lack of education, large scale of import, moral culture. First thing to talk about the unemployment is the worst problem in India, which increase the poverty. Unemployment is a bad and leads to a loss of income or output and feelings of hopelessness. Unemployment may be defined as a person who is able and ready to work. It is unable to find a well paying or good job. Causes of unemployment, jobless growth, education system, rapid population growth, disorder. Lack of education, lack of textbooks in school library, poor lecturer and lesson prepared teacher, lack of school facilities and equipment, renewed classroom, large scale imports. The another thing related to large scale import is causes for the poverty. In India, raw material has to import for industry. In India, if we decrease the import and started own supply chain from our country, the natural resources, then people will have better chance to earn. Moral culture. Moral culture also play a very important role to increase the poverty. Moral culture means social unfairness, dishonesty, and irresponsible behavior of people. Today, time everyone is trying to earn money to become rich by using unfair work. The shopkeeper is ready to get wholesale money from the packet of customer. Next thing, overpopulation. Poverty is leading to causes of overpopulation. Overpopulation in India is a crude fact. Due to overpopulation, people who are unable to collect two times food on regular basis do not stop from giving birth to babies. Street children simply grow up without adequate food facilities and education due to overpopulation. These above factors increase the poverty. Effects of poverty on health. The main effects of poverty is remuneration through various layer of citizens' life. If if we try to have a systematic look at them, we should move under the following three gates: effects on society, health, and economy. Effects on society means the poverty applies some seriously concerning effects on the overall societal health as well. There are some points given: homeless, child labor, stress, crime related violence. Effects on health. One of the most destructive effects that poverty has on the overall health the country. The most important health problem stemming from poverty is malnutrition. Insufficient income in big family leads to lack of access of sufficient nutritious food for the children. These children after sometimes suffer from various health issues like mental problem, low body weight, weakness, physical problems, etc. Effects on economy. Poverty is a direct index indicating success of the economy of the country. The number of population living under the poverty threshold indicates whether the economy is powerful enough to generate sufficient job and facilities for its people. Health hazards of poverty. Communicable diseases, that is related to water, the waterborne diseases, foodborne diseases, respiratory diseases, is related to non-communicable diseases, malnutrition, anemia, vitamin and mineral deficiency, social problem related to drug addiction, alcoholism, antisocial behavior, beggary, violence, terrorism, mental problems related to depression, loneliness, suicidal tendency, etc. The important steps to decrease poverty. There are some important points for decreasing poverty. These are: first one, increase the employment opportunities, increase the self plan and strategy, fulfill the primary needs of people like food and clean drinking water, improvement of the subsidy rates on commodities and the public distribution system should be made. All facilities of health center should be provided by the government. Free education facilities like books, bags, dress, fees, etc. Promoting education related to control the poverty. The promoting awareness regarding birth control below poverty line. It's defined as cutoff line of per capita income. Monthly income, per capita income is related to monthly income, below which it is not possible to purchase food, to obtain the minimum desirable limits of energy, and each and everyone consume food per day to calculate it that in universal level. This related to 204 calories per person per day in rural area, 2100 calories in urban areas. Poverty is the main issue created some of the that related to health care system affect to the health care. These are related to affect the people and the population. Healthcare is a very important factor in every economy, and it is addressing health inequalities requires a broader approach that tackles the underlying the social and economic factor that contribute poverty and inequality. The policy implication related to healthcare, the policy aimed at reducing poverty and inequality, such as investing in education, healthcare, and social safety nets, can have significant impact on improving health outcome. Childhood malnutrition. Poverty inequality are major drive childhood malnutrition leading to stunted growth, impaired cognitive development, and increased risk of infectious diseases. Chronic diseases related to inequality can risk of chronic diseases such as diabetes, heart diseases, cancer, as those which lower socioeconomic status may have less access to healthy food, health care, and preventive care. Poverty and healthcare is related to some of the inequalities in the situation of mental health problems, such as depression and anxiety, as individual may experience chronic stress, lack of social support, limited opportunities. These are related to affect the population to occur the deficiency of intake the food, vitamins. This can later to create the economy in the situation of poverty and healthcare linkages. Thank you to all.